A nurse who treated Boris Johnson when he was battling COVID-19 has resigned over the government's lack of respect towards the NHS and healthcare workers in Britain. Jenny McGee treated Prime Minister Boris Johnson for 2 days when he was in the intensive care unit in St. Thomas's Hospital in London due to COVID. McGee, who hails from New Zealand, was one of the 2 nurses who was singled out for praise by Johnson for their care and help during his spell in the hospital last April. Prime Minister Johnson had heralded McGee and one of the colleagues for staying by his bedside at London's St. Thomas's Hospital when things could have gone either way.
And I hope they won't mind if I mention in particular 2 nurses who stood by my bedside for 48 hours when things could have gone either way. They're Jenny from New Zealand, in Invercargill on the South Island to be exact, and Luis from Portugal near Porto. And the reason in the end my body did start to get enough oxygen was because for every second of the night they were watching and they were thinking and they were caring and making the interventions I needed.
However, in an embarrassment for Boris Johnson, McGee has now quit the NHS, further lambasting her former patient and his government's treatment of health staff. McGee has been condemning the government's highly criticised proposed 1% pay rise for the NHS staff. In a statement, McGee said, and I quote, "Lots of nurses felt that the government hadn't led very effectively. The indecisiveness, so many mixed messages, it was just very upsetting," unquote. Various unions have dismissed a recommended 1% pay increase for NHS staff as pitiful and bitterly disappointing. However, Johnson's office has made no direct response on his remarks. It has further said that the government would do everything in power to support the NHS workers. WION is now available in your country. Download the app now and get all the news on the move.